Hi, I'm Adrienne, presenting work titled Divided We Stand, the collaborative work of patients and providers in an enigmatic chronic disease. There's a rich body of work in CSCW and HCI that guides development of tools to support care of chronic illness. Our work specifically focuses on enigmatic chronic diseases that are poorly understood scientifically and difficult to manage. There's no biomarkers to rely on, and it's unclear which symptoms to rely on, so monitoring is difficult. There's no established guidelines, so treatment is difficult. And there's a lot of obstacles to communication, so partnership and understanding are difficult for both patients and providers. Our work specifically focuses on endometriosis, a debilitating illness impacting 6 to 10% of reproductive age women. There's no biomarkers, no clear treatment guidelines, and no cure. Our study is driven by two main research questions. The first, in the work of patients and providers when caring for endometriosis, what aspects of their work pertain specifically to such a complex condition? This is driven by the frameworks of work and patient-provider collaboration, especially when patients have a lot of knowledge. The second research question, what role does technology play in facilitating the partnership and the success of endometriosis care, and what opportunities are envisioned? We see this as our main contribution of this work to help design for common ground and sense-making in a context of complexity and uncertainty. In this qualitative study, we conducted semi-structured interviews with 10 endometriosis specialists and 5 focus groups with 21 endometriosis patients. The details can be found in the paper. We conducted a thematic analysis of the transcripts, extracted insights about the work and technology in the form of themes, and used these themes to come up with design implications. We found that patients want to use their records and data to construct a holistic picture of their illness trajectory, reflect and make sense of their illness experience, both over the short term and the long term, and facilitate care and self-management. And this is true for patients on their own and together with their providers. But the complexities of endometriosis as an enigmatic condition complicate care. We have 4 main themes. I'll go over them briefly and then give details of one. So the enigmatic nature and lack of medical guidelines means that it's difficult to make sense of what's going on, and it's hard to figure out what kind of treatment might be effective for a particular patient. The multi-factorial and systemic features of the disease mean that there's a lot of body systems involved and symptoms beyond pelvic pain and pain during your period, like fatigue and GI symptoms. This overwhelms patients and providers working together for comprehensive care. The third theme, the chronic and temporal dynamics, which are experienced quite differently for patients and providers, adds a lot of confusion. And finally, the interpersonal dynamic of patients and providers, where patients have to become their own advocates, and providers emphasize getting on the same page as patients about expectations of care and treatment. So there's a lot of negotiation of knowledge and expertise, which is necessary and beneficial, but there's also a potential for significant patient-provider misalignment. Here's an example of the chronic and temporal dynamic theme, where patients and providers have very different perspectives about the granularity of their understanding of illness. These mismatches really guided our design implications. So we came up with 3 design opportunities. The first is to construct and curate a holistic representation of the illness trajectory and health status, and this opportunity really supports the next 2. The second is to help reflect and make sense of the illness experience. This relies largely on visualization techniques. And the third is to scaffold collaborative work and actively correct misalignments. And this uses a lot of templates. Some details on this first design opportunity: to link and synthesize the clinical and the raw self-tracking data into a comprehensive timeline. Second is tools for data curation, which is found in other similar research, to transform these artifacts that are used for independent use into artifacts for collaborative use to support care. And finally, leveraging narrative to tell a patient's story, and then integrating these with data-driven solutions to reflect on and craft representations of a patient's personal illness trajectory. Thanks, and here's our contact information to reach out.